few months ago, I noticed this little growth right here in the palm of my hand. And you really can't see it, but you can feel it. And I went to have it looked at the other day because it was causing some pain. And the doctors set me up with a orthopedist, and I went in on Wednesday this last week, and it's not a cyst like we thought. It's something called Dupuytrens Contracture, or Palmer's fibrosis, and that's Palmars. And it's basically the tissue that's in your hand that thickens it up, that lets you have good grip. That skin, that collagen, that substance is changing, and it is hardening into knots and cords that can resemble tendons. And what it does is takes for me, it'll be, and it's most prevalent in the ring and pinky finger. And what it will do is slowly pull it in, and it'll be like this, and it'll curve in, and I will not be able to open my hand up anymore. And it can be very slight and stay that way, or it can be very, almost all the way, kind of like Bob Dole. Yeah, for those people old enough to know who Bob Dole is. And the thing is I was reading a lot of stuff, and it usually does not affect people my age. I turned 38 in April. It usually affects people over the age of 50, and prevalently men of Northern European heritage, which is Viking, Scotch, Irish, Anglo-Saxon. And it just kind of hit me, because there is no cure for this. They can delay it, they can go in surgically remove it, but that takes a lot, and there's so many tendons and nerves in here that it could mess up. And if they remove the knots and the cords, they may have to remove some of the skin, and then I'll have to have a skin graft put on, so that makes it even longer. So this is something I'm going to have the rest of my life, and there is no cure, but it's not a deadly disease. It's just a crippling one, because when your hand's like this, there's not much I can do because I'm right-handed. Add that to the fact of a little while back, I found out I had high blood pressure, and I'm diabetic. Now, that can be treated, and I could be, as long as I lose the weight, I can not have to take medication for those. But in the last 2 months, I've got high blood pressure, diabetes, now Palmer's fibrosis. And Palmer's fibrosis, there's nothing I can do about it. There's nothing. I can stave off the stuff, I can bend the hand, but eventually, if I live long enough, my hand's going to curve. Yeah, so that's what I've been dealing with for the past week. And yeah.